next candidate is Andrew Sharp. He's a children's book publisher from Waltham Forest, and this is what he looks like. Andrew Sharp!
Hi, good morning everyone. As Rufus just said, I'm Andrew Sharp. Can you hear me?
Yeah.
Good. Okay. Unlike Catherine, I'm going to rely very heavily on my notes. I've just spent the week in the US and my brain is somewhere over the Atlantic and my ability to memorise anything is close behind it, I think. As Louise has said, the NHA can really reach out to people. I am the living proof. I am not a clinician, okay? I have never been working in the NHS, as Rufus has said. I'm a children's book publisher. So the NHA really can reach out to the community beyond the health. Sure, my brother Matthew died of cancer, aged 6. I was 4. Matt's death, of course, had a huge impact on my life and on my sister's life. It's only since having kids myself that I can really appreciate the horrors that my parents must have been through. Our story, though it's sad, is in no way unique. We all hold love and loss in common. They're part of all life, a life for all humanity. In England, we hold the NHS in common too. It supports us in our times of deepest need. What would have happened to my family without the NHS? Steve Smith, who's the creator of the Big Up the NHS blog, made me question this directly during the Without the NHS Twitter storm, so hello Twitter. I contributed 2 tweets to that that really sum up why I now have to stick up for the NHS. The first was about Matt and my family, which reads, "Without the NHS, my parents would have had to bankrupt their young family when my old brother was ill with cancer. For 2 years, the NHS cared for Matt, just as it will care for us all. There's no payment required beyond the taxes we already pay. If forced to pay, my parents surely would have bankrupted themselves trying to save Matt's life, and then failed. Don't be fooled by my accent. We weren't rich. I'm the son of the milkman, and not in some jokey, metaphorical way. Any parent..." Sorry, leave the jokes to Rufus and me. Any parent would willingly bankrupt themselves, wouldn't they, if they thought they could save their child's life? And if the attempt failed, they lose their child, their home, and their other children's prospects in one fell swoop. Well, that can't be right, can it? Not when we have a better way, and we do. We have the National Health Service way.
Yeah.
Some people think the NHS will always be there, but it's looking precarious right now. Some would say, get health insurance. Well, cancer care is an expensive business. And have you ever known an insurance company that tried to dodge paying out in full on an expensive claim? Be a car, a burglary, whatever it may be. It's happened to me, it happens all the time. And it happens to millions of people in America where healthcare is startlingly expensive. Did you know, and many people will know this, but did you know that healthcare costs are the #1 cause of bankruptcy in the US? Causing 62% of bankruptcies. People going bankrupt just trying to stay healthy or keep loved ones alive. Of these people, over 75% do have health insurance, but it doesn't pay out and leaves them destitute. And what of those who lack the means to pay? Should we just let them suffer? Let them die? We don't need to worry about any of this though, do we? We have the NHS. Our politicians have promised that our healthcare will remain free at the point of need. So while they marketise and privatise our NHS, we're being promised private healthcare for free, right? Well, don't believe that. Not for one moment. Free at the point of need is just what they're saying now. It's a stopgap. Charging will follow. So the politicians and their empty promises lead me to my second tweet of the Twitter storm, which reads, "Without the NHS, I would have less pride in this country. The NHS speaks to our democracy, compassion and civility. Let's keep it." We all rely on the NHS at some time in our lives. It's a power for good. It's a democratic institution that looks after every man, woman and child, irrespective of their social status or financial means. It's a mark of great civilization. We see how politicians subvert democracy to pursue their own agendas for the NHS. Do we see compassion and civility? Do we see them in the coalition's government's approach to sick and disabled people and the work capability assessments? Where is the compassion towards those who are forced from their homes and into destitution by the implementation of the bedroom tax? Where is the civility to people who face the humiliation of having to rely on food banks to feed their families? A growing number of people are suffering from that malnutrition across this country. Government policy is doing real harm to people's health and places further strain on an already beleaguered NHS. Well, I don't see much compassion or civility in our politics, but I do know that this country is full of compassionate, civilised people. Yes. I only recently started campaigning, and already I have seen so much passion for the common good, so much will to sustain the NHS that sustains us all. This does fill me with hope and propels me forward in my certainty that I too must stick up for the NHS. I know that when I need it, the NHS is there for me, just as it was for my brother, just as it is for all of our loved ones. I want the NHS to be there for my kids, and for their kids too. So please join me in this fight. Vote for the National Health Action Party on the 22nd of May, and together, let's stick up for the NHS.
Brilliant! Andrew Sharp, ladies and gentlemen. I'd like to thank him for delivering many of the things I was also going to say.